Anemia. Anemia, what do you mean by anemia? Anemia, have you heard about anemia?
Ma'am?
Anemia,
Yes,
have you
ma'am.
heard?
Anemia.
Yeah,
Yes,
anemia.
ma'am.
Oh, tell me.
Yes, ma'am. It's a condition in which you enough red blood cells carry
What
oxygen
condition
and
which?
other functions.
Condition
In
which?
which you lack enough red blood cells
Lack
for
of, yes, very good, very
yeah.
good. Yes, you know. Okay. So the condition which the deficiency of red cells or hemoglobin, okay, resulting in pallor and weakness of the body. Okay. Anemia is the blood disorder characterized by red blood cell count, reduction in the red blood cell count, hemoglobin or PCV, packed cell volume. Okay.
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 Okay, ma'am.
Okay. So you can see the difference between the normal and the anemic amount. Less
Yes,
number of
ma'am.
RBC in
Anemic.
less number of RBC in
Anemic.
Oh, okay. So in this, the decreased oxygen carrying capacity, in anemia, we can see
Yes,
the
ma'am.
decreased oxygen carrying capacity of blood. Okay, decreased
ma'am.
oxygen carrying capacity.
Okay, ma'am. Okay, ma'am.
1 gram of hemoglobin can carries how many ml of oxygen? 1 gram of hemoglobin.
I don't remember.
1.34. 1.34 ml.
1 point.
Normal hemoglobin content of blood is normal
Uh,
hemoglobin content.
7. No. 7.5.
No,
No,
normal.
that's the size.
No.
That's the size. No.
14 to 8. Normally 14 to 16 gram per dl in males, whereas in females 12 to 14. Okay.
Okay.
Gram per dl. Okay. So the classification of anemia. Next, we are going to discuss about the classification of anemia. Anemia, can you define anemia? Anemia is a condition which
And
there is a
the body
decreased amount of
red blood cells.
okay, or the hemoglobin.
Oh, hemo.
So the decreased oxygen carrying capacity leads to the decreased oxygen carrying capacity of the blood. Okay, the next is the classification of anemia. So two types of classification, morphological and the etiological classification. Morphology means based on the size or the or amount of hemoglobin, etc. Next, etiological classification means based on its cause. Etiological means based on the cause. So there are two types of classification, which are the morphological and the etiological classification. Morphological and etiological. Etiological means cause. Okay.
Cause.
Yes.
Based on the cause. Yeah.
Morphological classification. First, we are going to discuss morphological classification. So morphology means depends upon the size and color of the RBC, color presence of hemoglobin. The size of the RBC determined by the MCV and the color determined by the MCHC. Okay, MCV and the MCHC. So this maybe ask for the Viva question, practical Viva. Okay. So in the morphological classification, there are 4 types: normocytic and normochromic anemia. Normocytic, so the size of RBC and normal and color of RBC normal. But the decrease is the and decreased number of RBCs in the blood. But the size normal, color normal. Maybe due to hemorrhage. Maybe due to hemorrhage. The normocytic, hypochromic, less hemoglobin. Then macrocytic, the large RBC, then become ruptured. And microcytic also, spherocytosis. Okay, these are the morphological classification of anemia. Next, we are going to discuss about the etiological classification. It's based on the cause or origin. Okay, etiology. Okay. First, anemia due to blood loss. Anemia caused by blood loss or increased blood destruction. Blood loss. Two type. Post-hemorrhagic, acute and chronic post-hemorrhagic anemia. Anemia due to blood loss, acute post-hemorrhagic and chronic post-hemorrhagic.
Okay, ma'am.
In acute occurs due to any accident, large amount of blood loss. So anemia. So anemia is here. You can see the anemia is normocytic and normochromic. Normal size
Yes, ma'am.
RBC, normal size RBC, normal color of RBC, but low, large amount of blood loss due to large amount of blood loss. Okay. Then chronic means
Okay.
small amount of this blood loss continuously from our body. Infestation, hookworm infestation, some piles, ulcer, etc. Okay.
Okay, ma'am.
Anemia due
Okay.
to blood loss, acute and the chronic.
Okay.
Okay.
Okay, ma'am.
Okay. Then anemia, next type, anemia due to a defective formation of blood or impaired red cell formation. Anemia due to impaired red cell formation means defective formation.
Okay, ma'am.
Okay, they are the nutritional anemias, means iron deficiency anemia, megaloplastic anemia. Okay.
Okay, ma'am.
Okay, due to disturbance of bone marrow function due to deficiency of these factors, nutritional factors, deficiency of the nutritional factors. Okay.
Okay.
So
Okay.
less production, iron deficiency and megaloplastic anemia. Then next anemia due to the disturbance of bone marrow function, not due to deficiency factor required for the erythropoiesis. Disturbance of the bone marrow, some aplastic anemia or lack of failure of absorption, then failure of bone marrow to function, etc. Okay, or maybe cancer in the bone marrow or any type of kidney diseases, etc. Okay, due to
Okay,
the
ma'am.
disturbance of the bone marrow. So, like kidney diseases. So, erythropoietin. Erythropoietin is a key factor for the production of RBC. So, when there is no erythropoietin, maybe lack of formation of RBC. Okay. Can you
Okay,
hear
ma'am.
me, Vishnu?
Yes, ma'am. Yes, ma'am.
Or cancer in the bone marrow. Maybe
Okay.
exposure to the X-rays. Exposure to
Okay, ma'am.
X-rays or gamma rays affect the bone marrow. So bone marrow cannot produce the RBCs. Okay.
Okay, ma'am. Okay, ma'am.
Okay. Okay. So the classification based on the etiology means classification based on the cause. Classification on the cause. First one is the blood loss anemia. There are two types. Post-hemorrhagic anemia, that is the chronic and the acute anemia. Chronic anemia and the acute anemia.
Acute anemia.
Okay.
Yes, ma'am.
Then we can add the hemolytic anemia also under this heading. Hemolytic anemia too. Hemolytic anemia due to the red cell destruction, greater red cell destruction. Okay.
Okay. Okay.
And next anemia due to the defective formation of blood or the impaired red cell formation of two types due to the disturbance of bone marrow due to deficiency factors.
Okay.
Production, decrease in the production, the deficiency factors, nutritional anemia, iron deficiency, maybe protein deficiency, like folic acid, vitamin C deficiency, all these deficiencies cause decrease the production of RBCs.
Yeah.
Yes.
Yes, ma'am.
Okay. And then next type means disturbance of the bone marrow function, not due to the deficiency factors, but due to some factors like kidney disease, then exposure to X-rays. Say, tell me, Vishnu, where are you?
Yeah, I'm here, ma'am. I'm hearing. Hello, ma'am.
Okay. Then some poisons or primary failure of the bone marrow to function, etc. Okay? Vishnu. Okay.
Hello, ma'am. Ma'am.
Yeah. Then megaloblastic anemia. Megaloblastic, what do you mean by megaloblastic anemia? Yesterday we discussed megaloblastic.
Oh, no, that's micro. Macro is bigger size.
Megalo also.
Megalo is also bigger size.
Two large cells.
Oh.
Folic acid deficiency, Yesterday we discussed, no? The factors, maturation factors,
unusual
vitamin B12,
bone marrow.
intrinsic factor. Yes, that is the megaloblastic anemia.
Bone
It's also
marrow
a nutrition
produces the
deficiency
bigger
anemia.
RBC.
Nutritional deficiency anemia. Okay. Okay.
Yes, ma'am. Yes, ma'am.
Then hemolytic anemia. Next is a hemolytic anemia. Because rupture of the red cell destruction. Okay, as a result of red cell destruction. Hemolysis means, what do you mean by lysis? Destruction.
Lysis,
Hemolysis.
yeah.
Destruction. Yeah, lysis means destruction. Blood cell destruction,
Very
hemolytic anemia due to the lysis of the blood cells. Okay.
okay. Okay, ma'am.
So anemia. Can you define anemia? Anemia is the decreased amount of
Red blood cells.
condition in which yes, red blood cells, and so leads to decreased oxygen carrying capacity of the blood.
And
Can you classify anemia?
Classification of anemia. First one is this thing, morphological, and
classification. And
second
the
one is
etiological
based on origin and cause.
etiological classification. Okay.
Then in morphological, we have 4 types.
Yes.
One is
Normocytic and normochromic.
Yeah, normocytic and normochromic. That is both are normal. Second one is normocytic and the color is different.
Not different.
Less. Color is less. Then third one is macrocytic and hypochromic. That means bigger and color is less. And then microcytic, that is smaller and lesser color.
Hypochromic. Okay, these are the morphological classification. Then the etiological classification.
Etiological classification comes to what all, ma'am? One is
blood loss.
Yeah,
anemia caused by
acute
blood
and
loss.
Chronic
Acute
blood
and chronic.
losses.
Then hemolytic
comes
anemia. Also hemolytic anemia.
Yeah, hemolytic anemia.
Hemolytic anemia too. Then
deficiency of vitamins.
Anemia due to defective formation, nutrition deficiency, and also other factors.
Then the bone marrow functions.
Bone marrow. Yes. These are the classification. Okay.
Yes, ma'am.
Anemia is also an essay question. We can expect an essay from anemia.
Yes,
okay. Yes, short essay, long essay, etc. Okay.
Yes, ma'am.
Then hereditary spherocytosis. It comes under hemolytic anemia. Okay. Spherocytosis. So the spherical cells. So it can be easily ruptured through by the slight compressions. Okay. In hereditary spherocytosis. So lysis of the cells occurs. And then also sickle cell anemia. Sickle cell anemia. You know about sickle cell anemia. Okay.
Oh, yes.
Abnormal type of. Yes. This is also easily ruptured. This type of cell also easily ruptured. Hemolytic anemia comes under the hemolytic anemia. Okay.
Okay, ma'am.
Then erythroblastosis fetalis.
Yeah.
Okay. So, yeah, the cells also fragile and easily ruptured. All these comes under the hemolytic anemia. All these 3. Okay. So, okay, Vishnu. So yes, anemia due to blood loss, anemia caused by blood loss, post-hemorrhagic anemia in this acute and the chronic anemia. Then the hemolytic anemia, hereditary spherocytosis, then erythroblastosis fetalis. More is there? What is?
Then
sickle cell anemia. Sickle cell anemia. Okay, then anemia due to the defective formation, nutritional anemias. Then lack of failure in the absorption or utilization of the any anti-anemic factors. Okay, or the bone marrow aplasia. Means failure of the bone marrow to function. Okay, that is mean aplastic anemia. Okay.
Yes, ma'am.
Okay, or some infection, etc. These are the classification of anemia. Okay, is that clear?
Yes, ma'am.
So when they ask anemia, you have to define anemia. Then you have to write the normal value hemoglobin. Okay.
Okay, ma'am.
Normal value in males it is 14 to 16 gram per dl, and in female it is
12 to 14.
12 to 14 gram per DL. Okay.
Yes, ma'am.
Below 8, the person will be anemic. Okay. Then the classification. Okay. Morphological classification and the etiological classification. Okay. Anemia. The red cell restriction. The symptoms of anemia. These are the common symptoms. Fatigue and loss of energy. Then rapid heartbeat. Shortness of breath. Headache. Then difficulty in concentrating. Dizziness. Pale skin. Then leg cramps. Insomnia. Loss of sleep. These are the symptoms. Vishnu, can you see the screen?
Yes, ma'am.
Okay, okay. So this is also the symptoms. Central nervous system, all areas, anemia, then eyes, skin, respiratory system, muscular system weakness, intestinal color change in the stool, then heart, chest pain, angina, heart attack, etc. Okay?
Yes, ma'am.
Then these are also the symptoms. Then spoon-like nails. Concavity, you can see the concavity on the nail. Then angular cheilitis, cracks.
This is the symptoms of what? Anemia, ma'am?
Anemia. Cracks in the lips. Cracks, you can see. Cracks. Then splenomegaly. Enlargement of the spleen. Then pallor of the skin. Then anemia, eyes.
Pallor of the skin, what happened, ma'am?
Pale color due to the less number of RBCs. Okay. These are the symptoms of anemia. Okay. So we discussed the fate of RBC, then the anemia. Fate of RBC is a short note question, then anemia. Long essay or short essay? Can we ask like short essay or long essay? Okay. Is that clear?
Yes, ma'am.
Okay, then we are going to discuss about WBC. Okay. Okay, WBC. What do you mean WBC? These are the another type of blood cell in our that can be seen in our blood, white blood cells.
Yes, ma'am.
Okay. Okay, yes, white blood cells. What is the function of white blood cell?
Defensive function, ma'am.
Yes. Very good. Then classification.
Granulocytes and granulocytes.
Yes, granulocytes and the agranulocytes. Presence of granules. Yes, there are 3 types. Which are they?
Neutrophils, eosinophils, and basophils.
Very good. Yes, very good, Vishnu. Then the agranulocytes are the?
Lymphocytes and monocytes.
Lymphocytes and the monocytes. Normal WBC count is?
Normal WBC count is that I don't know. I think 18,000.
4,000 to 11,000. Okay, no. 4,000 to 11,000 cells per mm cube. Normal RBC count is? Normal RBC count? No. RBC count.
Normal RBC. RBC is 14 to 16 per ml.
No, that is hemoglobin, Vishnu. That is hemoglobin. RBC.
RBC, what is it now?
Red blood cell count. 4.5 million cells. Nearly 4.5 million cells per mm cube. WBC? 4,000 to
11,000.
RBC count 4.5 to 5.5 million cells. WBC 4,000 to 11,000 cells only. Cells. Less number.
Okay.
WBC. Okay. So these are otherwise known as leukocyte. Can you see the screen?
Yeah. It's in WBC.
Yes, leukocytes. WBC only you can see the WBC?
Yeah, now it came.
Okay. Otherwise known as leukocytes. They are the colorless cells involved in defending immunity, provides immunity. Involved in defending the body against infectious diseases and the foreign invaders. Then this also produced from the hematopoietic stem cells. Yesterday we discussed about this. Then the leukocyte are found throughout the body, including blood and the lymphatic system. Okay. They're classified into 2, the granulocytes and the agranulocyte, Okay. Neutrophil, eosinophil, basophil, monocyte, lymphocyte. Okay. This is the picture of the WBCs. See the monocyte, kidney shape, eosinophil, basophil, S-shaped nuclei, neutrophil, polymorphonuclear cells, means mini nucleus. Okay. Then the lymphocyte, small lymphocyte and the large lymphocyte. These are the WBCs. Okay. And the normal value 4,000 to 11,000. Okay. Increase in the number of leukocytes are known as the leukocytosis. Decrease in the amount is known as leukopenia. Okay. Main function is defense mechanism. Function is defense. Okay. WBC is mainly the neutrophils and the monocytes. Which cells? The neutrophils and the monocytes provide second line of defense. Okay. The second line of defense. Actually, the macrophages is there. No, macrophages provide the first line defense. Okay. The neutrophil, then the monocyte defense against the microorganisms, virus, or other agents. Okay, that enter into our body. Okay. Then they engulf the particles and the particles or the bacteria, and they digest them. And this process is known as phagocytosis. Phagocytosis. Okay. So thus they provide immunity or defense. Okay. Then also they plays a main role in allergic reactions. The eosinophils, mainly the eosinophils. And also providing role in parasitic infections. And provide immunity, etc. These are the functions of WBCs. Okay. So we had discussed about RBC and RBC. Discussed about the structure of RBC, normal value of RBC. Okay, and the formation of RBC, the fate of RBC, and decreased amount of RBC known as anemia, etc. And the ESR and the PCV also we discussed. Then we discussed WBC, the function, WBCs and the functions. Okay.